In this portion of the class, we will discuss the role nutrition plays in joint replacement surgery. Eating a generally healthy eating pattern promotes overall well-being by reducing risk of chronic disease and helping to maintain a healthy weight while ensuring that nutrient needs are being met. A healthy eating pattern includes eating a wide variety of foods from all the food groups in proper portions. It is recommended that half of your plate should be filled with fruits and vegetables. By eating a variety of colors, reds, yellows, oranges, greens, purples, whites, you can ensure that you are consuming a good mix of vitamins and minerals. Using fresh herbs can add a splash of flavor. Depending on the time of year, fresh fruits and vegetables may not be available. Frozen options are easy to keep on hand to ensure that you have fruits and vegetables on every plate. When it comes to grains, at least half of your intake should be from whole grains. Whole grains include oatmeal, whole wheat breads and pastas, granola, and quinoa. Grains should make up about 1/4 of your plate. The remaining fourth of your plate should contain protein. Choosing lean proteins decreases overall calorie and fat intake, which is important in promoting heart health. Incorporating more plant-based proteins in your regular eating pattern provides the additional benefit of fiber as well as a different mix of vitamins and minerals. Dairy provides a balanced mix of carbohydrates, proteins, and fats. Dairy products are good sources of calcium and phosphorus, which are essential for bone health. The dairy food group can be a great option for a filling snack between meals. There are some nutrients that are widespread in our food supply, and overconsuming these items over a long period of time can have negative impacts on your overall health. Nutrients to limit in your diet are salt, added sugar, and saturated fat. These nutrients can be found in large amounts in highly processed foods. Following any surgical procedure, consuming an adequate amount of protein can improve tissue healing. As previously mentioned, proteins include meats, beans, dairy products, and eggs. Consuming at least one source of protein at each meal and snack will ensure that you are eating an adequate amount. Due to some of the medications you may take after surgery, you may experience constipation. To help prevent constipation, it is recommended to have adequate fiber, fluids, and activity. Physical therapy will help you achieve adequate activity through the Progressive Rehab Program. Fruits, vegetables, and whole grains are good sources of fiber, and fluids should be consumed throughout the day with an emphasis on good water intake.
Elevated blood sugar can affect how well you heal after your surgery. In this section of our class, let's discuss the nutritional recommendations for controlling moderately elevated blood sugar. Elevated blood sugar, or prediabetes, can be defined as an A1C of 5.7 to 6.4, or a fasting blood sugar consistently between 100 to 125. What is A1C? It is a test that can tell you what your average blood sugar has been over the past 3 months. One of the most common conditions that plays a role in the development of prediabetes is insulin resistance. When you eat too many carbohydrates, your bloodstream becomes full of sugar. Insulin resistance makes it harder for you to clear all that sugar out of your blood and get it into your cells. Wound healing after surgery can take longer if your blood sugar is elevated. The risk of infection is also higher when your blood sugar is elevated. Eating a wide variety of foods that include non-starchy vegetables, high fiber complex carbohydrates, and lean proteins are the foundation of the nutritional recommendations for prediabetes. Let's discuss how your plate should look. Try to have 50% of your plate filled with non-starchy vegetables. That can include, but is not limited to, asparagus, broccoli, Brussels sprouts, cabbage, carrots, cauliflower, green beans, lettuce, summer squash, or tomatoes. Fresh, frozen, or canned veggies without added salt are your best choices. These foods are unlimited and considered free, so fill up your plate. Next, fill 25% of your plate with whole grains like brown rice or quinoa, beans, peas, whole wheat pasta, potatoes with the skin, or corn. Yes, corn and potatoes, including white and sweet potatoes, are healthy in limited quantities. They have potassium, fiber, beta-carotene, and other vitamins and minerals your body needs. Use frozen or fresh, if possible, and limit servings to 1/2 cup per meal. In the last 25% of your plate, have lean proteins such as chicken, turkey, fish, or beef. Avoid battered or fried protein. For dessert on the side, have fresh fruit or low-sugar Greek yogurt. Recommended fruit servings are 1/2 cup frozen or fresh, 1 medium-sized whole fresh fruit, 1/2 banana, 3/4 cup of berries, or 12 to 15 grapes. Limit fruit juice. Avoid syrup-packed canned fruit. For your beverage, water or sweet tea is recommended. Increase your daily fiber intake with a goal to reach 25 to 30 grams. Eating a variety of fresh fruits and vegetables and whole grains will help you meet your goal. Processed food products are foods that have been altered to become more conveniently shipped, prepared, and consumed. They often have more sugar, salt, fat, and added chemicals. These food products can significantly add simple carbohydrates to your diet that elevate blood sugar levels. Avoid excessive intake of added sugar by limiting sugary beverages, cakes, cookies, candy, and processed snacks. Sugary beverages include sweet tea, regular soda, lemonade, or other bottled sweetened beverages. Limit portion sizes of refined carbohydrate foods such as white bread, white rice, and white pasta. If having a refined carbohydrate food as part of your meal, such as white rice or pasta, have a small portion size. Focus on 1/2 of your plate being high fiber, non-starchy vegetables. Limit saturated and trans fats by choosing lean protein and low-fat dairy. Remember that hidden fats are used to extend the shelf life of processed foods. Most foods that are packaged will often have higher levels of trans fats. Avoid these overly processed foods.